Tariq Shahab is a very caring, distinguished, and talented cardiologist. He performs high-risk interventions for patients with blockages in coronary heart arteries as well as arteries in other parts of the body. His work is appreciated by various hospitals and societies. His patients come from all over the states: New Jersey, North Carolina, Delaware, Michigan, and Minnesota, to name a few. Recently, Inova Fairfax Hospital, the top cardiovascular center in the country, sent him the letter of thanks. They also made a special video which is posted on their website.
Blockage in his right coronary artery was very tight, very calcified. They did try at other places to put a stent or fix it, but they could not, so he had 2 or 3 procedures done before even he saw me at that time. I did not hear from him for 8 to 10 years. We took Mr. Haller to the cath lab, and then we started doing the angiogram. This is the catheter here, and we injected the dye in his right coronary artery. I was surprised to see that he had 100% blockage here in the right. There's no blood going down the artery. I have been trained to do very high-risk angioplasties and stenting patients with multiple blockages, patients who have very high calcified stenosis. What we do here is to use this special rotor-rooter device, which has a diamond-shaped burr with a lot of chips in it that can really pulverize and break those small calcium. Once you can break the calcium, then it is easy to put a balloon in or put in a stent in. Eventually we were able to deploy the stent fully and use different balloons to do that. And now that after the stent, look at it. See how the blood is going? Good. Bob is one of those patients that is fortunate that we were able to fix him with these new techniques and with the skills that I use.
Not only does he excel in interventions, but he has an emphasis on prevention of cardiac disease and stroke. He was saluted for that with papers and presentations in Kentucky. He took his teachings to classrooms, churches, and women's clubs, preaching the importance of prevention.
A Corbin cardiologist is taking his medical crusade to the high school classroom.
Dr. Tariq Shahab's message to the students: prevention rather than treatment of disease is the key to solving the medical problems in rural Kentucky. As medical reporter Jerry Sander learned during a visit to London, Shahab has a very willing audience.
Yeah, with Shahab, these sessions become more than classroom assignments. They represent a pulpit from which the heart specialist preaches a weekly sermon of healthy habits. His message: the young people of Kentucky must change lifestyles that are generations old.
To be a smoker.
He's from the other side of the globe, Pakistan. But for a year now, home for Dr. Tariq Shahab is Laurel County, Kentucky. And this young doctor is clearly concerned about the lifestyle and resulting high death rate in the area.
And in my practice, I started seeing so many young patients with heart attack and high blood pressure and stroke and cancers. That really bothered me.
The youngsters are impressed by the staggering statistics. Anybody would be. 1 in 3 Kentuckians dies from heart disease each year. The death rate for Kentucky men from lung cancer has increased by 76% over the past 20 years. For women, the increase is more than 200%. Almost 1 in 3 Kentuckians smoke cigarettes.
In this part of the state, as well as the entire state of Kentucky, we lag far behind. The public health education, the health awareness is not, the message is not gone through to them. Arteries are clogged up and you are likely to have a heart attack.
Shahab has already cleared the way for an expansion of his mission to more schools and more counties. He might be viewed by some as overly optimistic, even naive, when it comes to enlisting government help to overthrow behaviors passed from one generation to the next. But he firmly believes that he's armed with the most powerful tool to make his crusade a success: education. He's got a hard road to hoe, but he certainly is committed, and he doesn't let go. Once he's got you,
Yeah.
he's told him.
Were the students asking questions, Jerry? Did they seem interested?
They're very attentive for 8 weeks, yeah.
So he's a heart surgeon. I guess he just takes time out.
He's a cardiologist, surgeon.
Okay.
Yeah, he takes time out, volunteers, goes to these schools and preaches the gospel.
But he's
All right.
interested. Okay.
One-man
Thanks,
crusade.
Jerry.
Thank you, Jerry.
To be
Coming next.
healthy, you need to eat a low-fat diet, exercise, and if you smoke, you need to stop. It's a message that's been around for a while, but according to some grim statistics, it's a message few Kentuckians are really hearing. But one doctor in London is trying to get people to listen, his patients, kids, and even other healthcare professionals.
Fine. Okay. The breakaway mirrors are going to be a feature that are available in all of our automobiles.
Roy Cheney smoked for 20 years until he sold Dr. Tariq Shahab a car. Roy Cheney isn't the only person Dr. Shahab is convinced to break a bad habit. So does Dr. Shahab. He helped start a program in southern Kentucky schools to educate kids. He says many of their parents simply don't know about healthy habits. And every day in his medical practice in London, he sees the tragic results.
If we continue to do this, we take care of people who are only 30, 35 years old and having heart attack, they go on to be disabled for the rest of their life. They're not working. They continue to have heart problems. They cannot live a normal life. So we ought to do something to prevent this premature occurrence of heart disease.
Dr. Shahab's efforts are all part of the Appalachian Health Educational Campaign. He's also hoping to win more converts among healthcare professionals at a symposium on preventing heart disease, cancer, and stroke at the end of this month in Berea.
Doctors say educating the public on preventive measures should remain a priority.
If we cannot change the public perception, if we cannot change the prevalent health standards in this state, we are not going to improve. And I think so that it is important even for the development of the Appalachia and to improve its economic condition, that we pay strong attention to the health of the young and the future generation.
He has presented many papers at the American College of Cardiology, American College of Physicians, and CRT meetings. He also has published many papers, few of which are original papers on the topic. He, along with other colleagues at the University of Michigan, described the phenomenon of pseudohypertension and wrote an editorial on pseudohypertension published in the Journal of Hypertension. Not only that, in Washington, D.C., during his interventional fellowship, he was among the first few physicians to try carotid stenting for blocked carotid arteries causing stroke. He presented the abstract at the American College of Cardiology and the first paper on carotid artery stenting in the Journal of American College of Cardiology. He returned to Kentucky and was the first to do carotid artery stenting.
This week on Jewish Hospital's Medical Moment, Dr. Tariq Shahab discusses the use of angioplasty and stenting to unblock the carotid artery.
Jewish Hospital, one of the nation's top 10 cardiac centers, brings you Medical Moment.
Stroke can be caused by blockages in the carotid artery. Dr. Tariq Shahab discusses the use of angioplasty and stenting to open blocked carotid arteries.
Carotid artery angioplasty is essentially a new technique that is done in patients who have carotid artery stenosis. There is blockage in the arteries here in the neck that goes to the brain, where we can, in a similar fashion, put in a catheter across the stenosis and do balloon angioplasty and then implant a stent, which will prevent the stenosis from coming back.
Enough about his scholastic achievements. Tariq Shahab is the fourth of 5 children of Syed Shahabuddin Ahmed and Masuda Khatun. He became a doctor to fulfill the dream of his father. He is involved in many social and charitable causes. He was the first to lead a team of healthcare workers for the earthquake relief in Pakistan in 2005. He is very much involved with many associations, including the Association of Physicians of Pakistan. He has been the chairman of publications for many years. He has good literary skills and has been involved in writing all his life. He recently wrote an article on the unfortunate plight of his father, who is suffering from Alzheimer's disease. We do not have much pictures of his childhood years, but the earliest one available is from his medical college years when he was a third-year student and published a magazine. He looks so young and like a school kid rather than a medical student. I asked him about it and he told me about how he's jumped from grade 5 to 8. When he was in grade 5, he scored second position in half-yearly exams. His father asked him to work a little harder so he could be first. He said, "Dad, if I get to be first, what about the guy who is first now? He will feel sad." That is the level of compassion he had since earliest age. He skipped grades 6 and 7. Later, he secured the 6th position in the pre-med exam for the entire board of Karachi. but he was having difficulty getting into medical school because he was underage. Let us all wish him the best for his new life along with his lovely wife Reema. Good luck, Tariq.